Good morning, everyone. Good afternoon, good evening, depending on your location. Have you ever been diagnosed of depression? Or have you ever asked yourself, why are some people suffering from depression and others not? It is normal for us to be sad and upset for our daily life from time to time and from our daily activities and situations. But when it becomes frequent for about 14 days, it becomes a mental health disorder called depression. Depression is a complex disease. It doesn't have a specific cause, meaning there are many causes or many situations that can lead to depression. Depression is characterized by loss of interest, lack of pleasure, even your hobbies, what you like doing becomes nuisance and less enjoyable. Lack of concentration, lack of sleep, in fact, feeling tired, lack of appetite. So let's look at the causes of depression. What really causes depression? So for the causes of depression, we have brain chemistry. There might be an imbalance, or let me say there can be a chemical imbalance in the part of the brain that controls our mood, our emotion, that control our feeling, our appetite, our sleep. Another factor we have hormonal level. Female always have some hormonal imbalance, that is the level of estrogen and progesterone during periods like menstrual cycle, premenopause, and menopause. This can lead to depression. We have disease conditions. Chronic disease conditions like cancer, stroke, Parkinson's disease can lead to depression. Other factors that can cause depression, we have pain. Pain can be a physical pain, that is a chronic physical pain. It can be an emotional pain or a sexual abuse. These factors can lead to depression. Another factor we have genetic factor. Depression can be a hereditary unit that can move from generation to generation, from parents, from children, grandchildren. It can be a hereditary unit. Another factor we have the use of certain medications like corticosteroids. They lead to depression. That is one of their side effects. Other factors we have for depression, conflict. People who have biological vulnerability, that feels are emotionally vulnerable, can easily get depressed when they have conflicts with your family members, friends, or loved ones. Another factor that causes depression, we have death or loss of dear ones, loved ones. The loss of a family member or a loved one can easily lead us into depression, especially when you have been attached to the person. Depending on the relationship we have with the person, loss of that person can lead to depression. But one thing we need to note here is that there are some disease conditions that can get worse due to depression. There are some disease conditions that can get worse when depressed. Such diseases are asthma, cardiovascular disease, cancer, obesity, diabetes. They can get worse. Some of the signs and symptoms of depression already mentioned before. We have feeling sad, hopeless, always pessimistic, cries a lot, lack of concentration, lack of sleep, lack of appetite, lack of pleasure, lack of interest, even in your hobbies. And the signs sometimes varies from male to female. Let's look at the pathophysiology of depression. Depression is a depletion of serotonin, dopamine, and norepinephrine. The depletion of these neurotransmitters are caused by the enzyme monoamine oxidase. So let us look at the treatment or method to come about when depressed. It is always very important to combine the medical treatment with the lifestyle management. The medical treatment options we have the cyclic antidepressants, that is the tricyclics and the tetracyclics. We also have the monoamine oxidase inhibitors, and we also have the serotonin selective reuptake inhibitors. Let's look at these treatment options one by one. Let us begin with the cyclic antidepressants. For the cyclic antidepressants, we have the tricyclics and the tetracyclics. They act so as to increase the amount of neurotransmitters in the brain. Example of tricyclic antidepressants we have amitriptyline and nortriptyline. For the tetracyclics we have amoxapine. They have a side effect, that is sedation, blurred vision, and dry mouth. So for the second treatment option, we have monoamine oxidase inhibitors. From the name, they inhibit the enzyme monoamine oxidase, which destroys neurotransmitters, dopamine, serotonin, and norepinephrine. Example of the drug include phenelzine. Another treatment option we have selective serotonin reuptake inhibitors. They act so as to inhibit the uptake of serotonin and increase their level in the brain. Example of such drug include sertraline. Other treatment options we have serotonin and norepinephrine uptake inhibitors. From the name, we can still know that they inhibit the uptake of serotonin and norepinephrine to increase their level in the brain. Another treatment option we have is psychotherapy. Psychotherapy acts so as to place the patient with a licensed therapist for him to express his feelings, and is taught on how to manage the situations, on how to go on to overcome all these situations. Let us look at the key factor of every treatment is patient advice. So for our patient advice during depression is that antidepressant drugs should be kept out of reach of children. Patients on antidepressant drugs should know that it will take about 2 to 4 weeks for the drugs to have full effect. Patients on antidepressant drugs should not skip or omit their medications, and if it happens, they should not double the dose. Patients on antidepressants should carefully and slowly change positions. This is because antidepressant drugs act on the brain, our central nervous system, and anything disrupting the brain, you have to carefully change your position to avoid fainting. We also have sudden stopping of the drug. Patients on antidepressant drugs should not suddenly stop their medication. And lastly, avoid alcohol. Let us look at how to prevent depression. First of all, we must practice enough exercise. Exercise improves the circulation of blood in our brain and our body, and this can help us release many other diseases other than depression. We have reducing the amount of stress. Stress releases the hormone cortisol, which is one of the factors that causes depression. Building strong relationship with our families, friends, and loved ones is very important to avoid depression. Having enough of sleep is very important. A normal adult should have at least 6 to 8 hours of sleep to avoid depression. Thank you for watching. Hope you learned something. And please subscribe, like, and share. Don't forget to press the notification bell for you to be notified of any video I post. Please, if you learned something, write it in the comment box. I'll watch it later. Thank you for encouraging me by sharing and liking. Bye-bye.